50s. Partly cloudy and jacket weather again heading into Wednesday morning. Our lows in the mid to upper 30s with a little improvement in afternoon temperatures. Partly cloudy Wednesday, highs in the mid 60s. I'm meteorologist Chris Michaels in the NCN Weather Center.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're discussing an important topic that affects many women. We are talking about HPV, the human papillomavirus virus. I knew I was going to mess it up. I had it rolling off the tip of my tongue when it started. But anyway, we are talking about that today because we want to bring awareness of HPV to our community, and we also want to bring in the Association of Cervical Cancer. And we mainly want you to get screened because screening equals early detection. And as you know, I preach it all the time. Early detection saves lives. So, ladies and gentlemen, joining us today, we have Dr. Leah Scarlato. She is a board-certified gynecologist who specializes in both routine and complex benign gynecology. And she is part of Cape Fear Valley Health's gynecologic oncology. And Dr. Scarlato, thank you so much for taking time out of your busy schedule to be with us today. We had pretty much started this whole discussion before the show even started. So first, before we get into what HPV is and how we can prevent it and that type of thing, tell our listeners a little about yourself and what made you get into this field out of all of the fields in medicine.
Sure. So first of all, thank you so much for having me. I'm new to the Cape Fear Valley system. I started here in August after getting out of the military, and I'm very happy to be here and be part of the Fayetteville community. What drew me to women's health initially is the ability to care for women through so many different important life transitions, from adolescence to pregnancy planning to helping manage irregular or painful periods, and then navigating our course through menopause as well. Every phase of life provides an opportunity for preventative health that can improve health outcomes and impact your quality of life. And so that's what really inspires me to continue leaning into women's health, is to be able to partner with patients and be able to talk with them and journey this life change with them through every phase of life.
Now, Dr. Scarlato, you mentioned painful periods. The reason why I'm bringing this in is because I suffered from painful periods before I went through menopause. I see my daughter suffering from it and my granddaughter getting ready to suffer, and she's suffering from painful periods, and she's really just starting. So in the African American community, I've noticed that a lot of us, the word fibroids come up a lot when it's associated with painful periods. What exactly causes all of that?
Sure. So fibroids are very common. They are usually benign or non-cancerous growths that occur in the uterus at different parts of the uterus. Fibroids are incredibly common. They occur in about 70% of all women and about 90% of African American women. There are multiple factors that contribute to fibroid growth, and some of that is age, hormones, genetics, like you mentioned. Those are the main components to this. And so whenever somebody has fibroids, if it's on, for example, the inside of the uterus, it can cause heavy periods. If it's on the wall of the uterus or outside the uterus, it can cause other symptoms such as a sensation of pelvic pressure or what we call bulk symptoms that can sometimes impact bladder or bowel dysfunction, impacting how you pee and how you poop as well.
Let's talk about the human papilloma virus. I know I probably said that wrong, but I started hearing about this back when my daughter was a teen, and that's when it was brand new. And the commercials Dr. Scarlotta, they freaked me out back then. Because they mentioned cervical cancer. And to ease someone's anxiety who may be going through what I went through, or who may actually be going through the condition, what exactly is HPV?
Yes. So HPV, or the human papilloma virus, you did great with that word. It's
Thank
not
you.
easy to say. All right. So the HPV virus is a very common virus that is transmitted from close skin-to-skin contact. And so it's different from, for example, HIV, which is transmitted through blood or bodily fluids, such as semen or vaginal discharge or blood. And it's different than HSV, which is the herpes simplex virus, which is transmitted through open sores on either your mouth or on your bottom. And so HPV is a virus that's transmitted, and about 90% of people will have HPV at some point in our life, or that was the number before the vaccination. HPV vaccine is something that can be transmitted very readily to any sort of what we call mucosal surface. So that can be the inside of your mouth, it can be the inside of the vagina, or it can be the anus as well. And so HPV can cause cancers that occur in any of those locations, including throat cancer, cervical cancer, vaginal cancer, or anal cancer. And so HPV vaccination is a way to help reduce the amount of HPV exposure to help decrease cancer numbers in our population.
How common is HPV?
So it's very common, and so our goal with vaccination, because without vaccination, it's present in about 90% of women under 30. The vaccination helps to decrease the amount of cancers by almost 90%. And so this vaccination is available to boys and girls starting as early as age 11 and sometimes even at age 9. It's only a 2-part vaccination series and can help decrease people's exposure. Our goal is to vaccinate children before they get exposed to that close skin-to-skin contact.
So you mentioned boys and girls, so men and women can get HPV?
Yes, men and women can get HPV. Men, for example, may sometimes have it in their throat or in their mouth from oral intercourse. And then they can also get HPV in the anus as well. And so by also helping to vaccinate young boys, it helps to decrease women's exposure as well. Because if the boys are not carrying it, then it's less likely to be passed back and forth between young men and women.
Ladies and gentlemen, in the studio, we're having a very interesting conversation with Dr. Leah Scarlotta. She is a board-certified gynecologist who specializes in both routine and complex benign gynecology. And she is with Cape Fear Valley Health's Gynecologic Oncology. And we're talking about HPV today on Cape Fear Valley Health's Making Rounds Live. Dr. Scarlotta, I hear about, well, hold on for a minute. Like I was mentioning earlier, I didn't hear about the HPV virus until my daughter was a teen. She's pushing 40 now. So like I said, this has been around for a minute. And for folks who are just joining us right now, and maybe they did not hear you say it, who should receive the HPV vaccine, and at what age is the vaccine most effective?
So the HPV vaccine is most effective the earliest that you get it. Boys and girls are eligible for the vaccine, usually starting around age 11 or 12, but can be administered as early as age 9. And it's a 2-part vaccination series when children are in their young adolescence. But we also have a catch-up series where women are eligible for the vaccination up until age 26. Some patients between the ages of 26 and all the way up to 45 may still be eligible and be good candidates for the HPV vaccination. And the goal of the vaccine is to help decrease the number of HPV strains that you're exposed to. So the same way that different viruses like COVID had the Omicron and the Delta and different strains of HPV, the HPV vaccine has 9 different strains that it covers, and that helps prevent anogenital warts as well as the cancer-causing HPV virus.
Dr. Scarlata, you mentioned as early as age 9?
Yes, and so that's something that can be talked about with your pediatrician
yeah.
or family practice doctor, yes.
Is there ever a time when it's too late to get the HPV vaccine?
So most of the time, age 45 is the cap for women to get the HPV vaccine, because the goal for the vaccination is to protect you from exposure, which is usually through close skin-to-skin or sexual contact. And so the more we can protect people before they have that first encounter of skin-to-skin contact, then the less likely they are to develop HPV themselves, and therefore less likely to develop cancer.
Ladies and gentlemen, Dr. Leah Scarlata, she is our in-studio guest today on Cape Fear Valley Health's Making Rounds Live. She is board certified and she specializes in routine and complex benign gynecology, and she is with Cape Fear Valley Health's Gynecologic Oncology. Now, if you would like to be part of this conversation, what you can do is you can give us a call at 910-483-6111. Again, that's 910-483-6111. Or if you're following the live stream, what you can do is you can follow us on Cape Fear Valley's Facebook page. And if you have a question about HPV or the HPV vaccine, you can leave that question in the comments section, and Lindsay will make sure that we get that question answered. And we're also streaming on Cape Fear Valley's YouTube channel, but Lindsay is only one person, so we cannot have her straddling from one social media platform to the other one. So, and the last thing is, I want you to make sure you share this information. We're discussing HPV today. Very, very, very interesting information, especially for our area. And our in-studio guest, Dr. Leah Scarlata, and she is with Cape Fear Valley Health's Gynecologic Oncology. Now, Dr. Scarlata, what would you say to parents who are like, I'm not going to get my child this vaccine? What would you say to those parents?
Sure. So that is something that's very common. You know, as your parent, you're trying to do the best thing for your children, and it's a very reasonable question. And I would encourage everybody to be your own best advocate whenever it comes to healthcare decision making, because our goal is shared decision making. So in terms of the potential fears regarding the vaccine itself, first of all, it is a very safe vaccine. It's one of the best studied vaccinations. There's been more than 135 million doses of the HPV vaccine given in the US, which that means it's been very well studied through all of those vaccinations, and it's incredibly safe. Another thing that comes up is that sometimes parents are concerned that if I give this to my child early, they may become more promiscuous earlier. And there have been studies that look at that, because that's an important risk factor as well. But however, the data shows that there is no increased number of sexual partners in a patient who's received the vaccination, and no earlier onset of intercourse in a patient who's received the vaccination.
And Dr. Scarlata, before we go into break, we all know that screening plus early detection, it equals saved lives. What are the current guidelines for the HPV vaccine/screening?
Mm-hmm. Yes, so the vaccination, it can start as early as age 9 in some populations. Mm-hmm. Routinely, it's given between ages 11 and 12 to both boys and girls. For women, it can definitely be administered up to age 26, and in certain populations, you may be a candidate up to age 45 for women. For HPV screening, we combine that with what we call the Pap smear. And the Pap smear is what we do at our GYN visits, part of your well-woman exam. It starts with that speculum exam that helps prop the vagina open so that we can see the cervix. The cervix is kind of like the neck of the uterus or the doorway. And so the Pap smear takes a sample, it's a paintbrush that takes a sample of the front cells of the cervix itself. And then the HPV testing tests, are you positive or negative for the HPV virus itself?
Ladies and gentlemen, Dr. Leah Scarlatta, she's our in-studio guest today on Cape Fear Valley Health's Making Rounds Live. When we return, we are going to ask her some questions for the older, seasoned ladies who are watching right now. Make sure you stay tuned. Cape Fear Valley Health's Making Rounds Live.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The We Do Radio Network.
God bless you. I'm Pastor Al McAllister, the pastor of Rafa Ministries Family Center Incorporated, and you are listening to Wake.
President Trump says U.S. and Iranian officials are engaged in talks to end the war, but Tehran denies any direct conversations are taking place. The president's decision to give Iran at least 5 days to come to some agreement on U.S. demands and how to open the Strait of Hormuz to oil shipment is still percolating right now, according to experts. North Carolina Senator Thom Tillis told ABC News this week that his attitude has changed since announcing he isn't running for re-election, and now he wants to make sure Republicans get elected this fall. A man is facing charges across multiple counties after a 60-mile car chase. It all started in Buncombe County when detectives conducted a follow-up investigation. There, they encountered Mitchell Monroe Gunner, who had an open warrant for his arrest. The chase went through 5 counties. Mike Rayleigh, NCN News.
I'm Jamie Monticelli, WIDU Radio News. The Cumberland County Sheriff's Office is alerting the public to a recent scam and robbery scheme occurring through Facebook Marketplace in the Everett Acres subdivision off Lake Upchurch Drive in Parkton. Detectives have gotten reports of an individual advertising air conditioning units for sale at discounted prices. When buyers arrange to meet and arrive at the location, they are directed to the rear of the residence. Once there, the suspect approaches the victim armed with a firearm and demands payment. Victims are forced to either surrender cash or transfer money via a Cash App account. Reported losses from those incidents have ranged from $900 to $6,000. Join the community for another Youth Night Out. The Proof Project is teaming up with the Office of Community Safety and other organizations for a Youth Night Out April 10th, 7 p.m. until 10 p.m. This is at Roundabout Skating Rink. Youth ages 13 to 18 are invited. From WIDU Radio,
Tuesday morning starting out much colder than yesterday morning thanks to that cold front that passed through just yesterday. Things are going to be significantly cooler, at least through today. High temperatures mid to upper 50s with more of a blend of clouds and sunshine. Overnight, it's partly cloudy. Temperatures dropping to about 35 to 40 degrees. And by Wednesday, a little improvement in our temperatures, partly cloudy and highs, making it into the middle 60s. I'm meteorologist Chris Michaels in the NCN Weather Center.
Bless the Lord. I'm Dr. Ann T. Newell, pastor of the Soul Harvest Apostolic Church, the church not just there in the community, but there for the community of Spring Lake, North Carolina. We're looking for more than a few good men and women to join the team. Iron sharpeneth iron. We may have what you need. You may have what we need. Catch the vision. Join the team. Join Wake Up.
Starting out with patchy fog after some overnight rain. Temperatures early on in the 70s. Heading into the afternoon, our highs upper 80s to near 90. Showers and storms will be pretty hit and miss early on, with a slightly better chance heading into the evening. Overnight, low to mid 70s with scattered showers. By Sunday, more of the same, upper 80s to near 90 degrees, with scattered showers and thunderstorms expected during typical hours. For the North Carolina News Network, I'm meteorologist Chris Michaels in the Weather Center.
Hi, this is Apostle Bernard L. Whitfield, Jr. of Righteous God Ministries, 348 Old Wilmington Road, 910-223-7591. The pastor is Phyllis Vernell Whitfield. Our service time is 9:45 Bible study, 11 a.m. service. Tuesday night Bible study begins at 6:45. And remember, come as you are. You don't have to clean up to get up, but come see us, and we'll be there for you. God bless you. Heaven smile upon you.
This is Pastor Sarah Alford of Joy Fellowship Outreach Ministry, and you are listening to Wake Up.
This is Bishop Johnny Ray Jr. of the Churches of Worship Worldwide, Apostle J. A. McDonough, 2118 Owen Drive. And we are proud to be a part of the Wake Up. Come and join the team.
We now return to Making Rounds Live,
Cape Fear Valley's Making Rounds Live.
broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Before we continue our conversation with Dr. Scarlata, what I want to remind you is that Step Up for Health, don't forget, that event is this Saturday, March 28th at Methodist University. It's a family-friendly event, so for those of you saying there's nothing to do in Fayetteville, this is a family-friendly event. It features a 4K and 1 mile walk, a survivor lap. There's a wellness expo, giveaways, and food vendors will be there, and there will also be music. Step Up for Health, don't forget that it helps support patient care services through programs like Friends of the Cancer Center, Children's Services, Heart Care, and the Nursing Education Scholarship. And these are just a few of the things along with many others. So what I want you to do is contact Ariana Bannerman at abannerman@capefearvalley.com. That's abannerman@capefearvalley.com. It's easier for me to give you an email address and a telephone number right now. So abanner at capefearvalleyhealth.com, and she can give you more information about Step Up for Health going on this Saturday out at Methodist University. Annual event, always an awesome turnout. So for those of you who are new to the area, make sure you make plans to attend. And today, our in-studio guest, Dr. Leah Scarlata, we are talking about HPV today. And Dr. Scarlata, before, while we were in the break, a question came up. Is there a difference between a regular OBGYN and what you do?
So I am an OBGYN myself as well. There's a special type of fellowship that one of my partners, Dr. Aksu, does that is more on the GYN oncology or the GYN cancer route. Now, HPV can cause cervical abnormalities that are sometimes precancerous and then also can change all the way into invasive cancer. And so within our division at the Cape Fear Valley GYN Oncology Clinic, there's Dr. Aksu, who manages the cancer itself. And then it's myself and one of my partners, Dr. Bakai. We are what we consider generalist or GYN specialists who take care of patients with benign or non-cancerous GYN concerns and also routine well-woman visits. We help take care of patients from pregnancy prevention with contraception, ectopic pregnancies, endometriosis, fibroids, bleeding, and fertility issues.
You mentioned women issues. One question that came up, as we get older, and I'm one of those people that fall into this category now, I have gotten mixed information about whether or not I'm supposed to get a pap smear or whether or not I'm not supposed to get a pap smear. So those of us who are menopausal, premenopausal, postmenopausal, what are we supposed to do?
That's a very common question that comes up. And so for a well woman exam, we recommend that being an annual preventative exam. Ideally, that occurs with either an OBGYN, a GYN specialist, or your family practice doctor. It can also be done through internal medicine as well. A well woman exam is a routine preventative exam that includes usually a breast exam and also a pelvic exam. And depending on your pap smear history, you may or may not be due for an actual pap smear itself, but we do recommend a GYN visit, including the pelvic exam, so that we can examine the vulva, which is the outside of your bottom, and the vagina, which leads up to the cervix, and then the uterus itself as well. And because many of these screenings can cause or can expose some abnormalities, that helps with early detection and early treatment.
What happens when you do have an abnormal result? When a patient receives one, what's the next step?
Yes, so pap smears are very commonly abnormal. They can result in a spectrum from stone cold normal to highly concerning. The next step after that is usually a procedure called colposcopy. Colpo is Latin for vagina, and scopy means to look. And so we basically do something similar to a pap smear, except that we'll be looking at the vagina and the cervix with a special lens in the clinic. And we coat the cervix with a solution. And then if the cervix has changes from abnormalities within those cells, we take small little microbiopsies. And that helps us know, are these changes impacting the tissue, or is it more just on that surface of the cervix?
Dr. Scarlotta, are there warning signs that women should never ignore?
So postmenopausal bleeding is never normal. You should always talk to your doctor about that. Other things that can sometimes distinguish or suggest that something abnormal is going on with the cervix is that if you have spotting or bleeding after intercourse, you definitely want to come in to do an exam so that we can examine the cervix and identify if something could be causing that. Or if you have very heavy or very painful periods or irregular periods, that's something that we can help you with as well.
Ladies and gentlemen, Dr. Leah Scarlotta with us today on Cape Fear Valley Health's Making Rounds Live. We're talking about HPV, the vaccine, the condition itself, how you can prevent it, the whole nine. Dr. Scarlotta, how can the health system and the communities remove the barriers that I've seen in the community regarding screening and care? Everything from something as minor as transportation to there are a list of things that, or let me rephrase that, excuses that I hear when I'm out in the community. Why aren't you doing this? Well, this reason, and this reason. So how can the health system and community remove these barriers?
Yes. So in order to help make healthcare more readily available, I think about kind of three main components. One being access, the next being commitment, and then finally is engagement. Now, access, you mentioned transportation, that can be a large burden for some of our patients. And we have an excellent nurse navigator named Skylar who can help coordinate and arrange transportation if needed. Other things that can sometimes prohibit people from coming to the clinic is time off of work or even childcare. Children are allowed in our clinic, so please don't let that deter you. It doesn't require a referral. That can also sometimes be a roadblock. Our clinic, you can call our clinic and we'll get you scheduled for your visit. For commitment, our goal is to be involved in the community by going to programs such as the Flourish Women's Wellness Fair that occurs usually in October, and identifying members in the community such as this organization to be able to help promote true healthcare information. And then finally, it's about engagement and maintaining that relationship and ensuring that we follow through for you as the patient. That can be through helping you set up your MyChart so that we can communicate easily, which is the portal through our healthcare system, and also setting up reminders that occur within your medical record so that even if you forget to call us, we'll call you to schedule that next appointment.
Dr. Scarlotta, can someone have HPV for years without even knowing it? And once again, the importance of that screening, why it is so important.
Yes, so HPV is usually silent, meaning it usually doesn't cause any sort of symptoms. And so people may not know that their cervix is starting to have some changes. It's the virus itself and the virus being around for a longer time within your system that can cause those cells to change over time from normal to abnormal, or from non-cancerous to precancerous, and then eventually sometimes cancerous. And so the HPV, you may not know that you have it, but part of how we help you prevent it is by using the vaccination to help decrease the number of exposures that you have. There's also some other components that can help improve outcomes or decrease cervical dysplasia, which is the precancerous changes. One is that tobacco use actually decreases your immune system's response, and that means that your body can't fight that HPV virus as readily. So one way to help decrease the amount of cervical cancer is to stop smoking, and that's something that we can help with as well, because it's not an easy battle. The other is limiting the number of sexual exposures that you have, or using what we call barrier or condom protection. And we can help with that as well. Sometimes there can be a large financial burden in acquiring condoms, and that's something that we can help you with.
You mentioned, in case there's someone who is just joining us and they may have missed the first segment of the broadcast, we were talking about symptoms earlier. What are the symptoms that people should be aware of in case they're just joining us?
So some people with HPV may not have any symptoms, but definitely some red flags that I would always want you to contact your doctor, and ideally us as your doctor, is postmenopausal bleeding or bleeding after menopause is never normal. We always want you to seek health care for that. Other things would be as if you're having spotting or bleeding after intercourse. That could also suggest that there's something within the cervix that could be causing this to occur. Also, if you have painful or irregular periods, meaning that they're not coming once a month, then we'd want you to engage with your healthcare provider.
Dr. Scarlata, I know there's someone out there listening right now, and she's saying, I know I need to get this, I know I need to get this test, I know I get this screening. But we were mentioning it during the break. Some of them may have the mindset of, or the fear of how everything was back in the day. And they're basically fearful about getting it. So what do you have to say to those ladies who have the fear of the big salad tongs from back in the day?
Yes, so that is a very common fear, and it's something that we want to be sensitive towards. First and foremost, you are the boss. If at any point during the exam you need a break, you just say stop. That is our safe word 24/7. And so you're in charge. And so we hope that provides a safe out if you become too uncomfortable. And then secondly, the vagina is essentially a potential space. When there's nothing in it, it lays flat or collapsed together, but we can't see the cervix up at the top of the vagina. That is the gateway from the vagina to the uterus. And so the speculum, which is that sometimes people call it the duckbill, it helps to prop the vagina open just so that we can see the walls of the vagina and also look at the cervix itself. And so if you're afraid about that, just let us know. We can help with that. And sometimes people, even we can do medications to help you relax as well. And also don't worry about painting your toenails or shaving your legs. It doesn't mean anything to us. You just come as you are and we'll help take care of you.
As we wrap up, Dr. Scarlata, is there anything that we did not cover today that you feel that our listeners and our viewers really need to know?
So I think just the biggest thing is that we're here to help take care of this community. And Cape Fear Valley has opened 2 women's health clinics within the last calendar year, which would be our clinic of GYN oncology, where we primarily take care of GYN care or non-pregnancy care, as well as a new midwifery clinic. So we're here to help support women in this community. The vaccine is readily available. It's usually covered by Medicaid. And if you're having concerns about the vaccination, or if you think that you are due for your pap smear or screening, we're accepting new patients. No referral is required. You can call our clinic at 910-609-3750 and we'll get you scheduled.
And give that telephone number once again.
Our phone number is 910-609-3750.
And the address?
The address is 413 Owen Drive, Suite 101 in Fayetteville. We're very close to the CVS right next to the main hospital.
And do they need a referral?
Most of the time, you do not need a referral. You can call our clinic. We have 3 amazing patient representatives, and they'll help make sure that if you do need a referral, we can help with that. But majority of the time, no referral is needed.
And Dr. Scarlata, this wasn't anywhere on the questions, but I've been watching you while you've been doing the interview. Why are you so passionate about what you do?
So I love women's health care. It's something that spans your entire life, and that at every phase of your life, from transitioning from girlhood to womanhood, from trying to become pregnant, trying not to become pregnant, irregular bleeding and that perimenopausal changes, and then postmenopausal care. You know, every point in a woman's life, there's something that we can help improving your health and your health outcomes, as well as your quality of life. Many times people think that women only go to the doctor when you're pregnant, but there's a whole aspect to you that's not about your pregnancy, and it's about your care and your wellness, and that's what I'm dedicated to.
Dr. Scarlotta, thank you so much for being with us today. This has been amazing. Thank you so much.
Sure. Thank you so much for having me.
And there's always an open door for you.
Yes.
Anytime you need to get a message out, you just let us know.
Thank you very much. I appreciate that.
Ladies and gentlemen, our in-studio guest today, amazing conversation with Dr. Leah Scarlotta. Dr. Scarlotta is a board-certified gynecologist who specializes, you heard her say, in both routine and complex benign gynecology. And she is with Cape Fear Valley Health's Gynecologic Oncology. And if you want the information, just go to the day's broadcast. Lindsay will make sure that we have that information in the comments section for you. So, ladies and gentlemen, our next broadcast is Tuesday, April 7th, so make sure you mark that date. And for our producers, Lindsay Graham and Ray Thomas, and the hardworking team behind the scenes, I'm Omega Jones. Thank you so much for watching and listening to Cape Fear Valley Health's Making Rounds Live.
This is Pastor